You are being left behind as a healthcare professional if you don't apply this new framework. That's right. If you own or want to own a clinic or medical practice, I want to share with you our new Practice Value Creator framework. This will have your patients rave about you, help you build a strong reputation in your area, attract quality employees to your practice, and allow you to make more money with less work. The fact is, most healthcare professionals hate the business side of healthcare. For example, the healthcare business changes so much it can be frustrating. New rules are always popping up that make your job of treating patients that much harder. Also, you may be saying that you just don't have the time to make the changes to your business that you need to because you're just too busy treating patients. Another issue we found was that money was already spent on business consultants who promised to help, but they just made things worse. Finally, you may just throw up your hands and wonder if it is even worth to deep dive into the issues of your business and just finally just sell out and move on with your life. What if I told you it would be worth it to truly transform your practice or clinic if you had an easy to follow checklist for success? You were guaranteed to receive compensation for your efforts. You had access to resources to help handle any additional workload. And finally, you had coaches and mentors supporting you and your staff toward this goal. Ultimately, with this framework, I want to help show you how you can help more patients, make more money, build a strong relationship in your community, and grow your medical practice or clinic to a level you never imagined before. As a healthcare coach, I have helped hundreds of organizations generate recurring revenue using our system and helping them increase the valuation of their clinics by 300% in under 12 months. But before all that, I struggled to help just one medical practice. Initially, I started in this business to help build the next generation healthcare consultancy practice, especially after the changes due to Obamacare. I saw personally the importance of this industry after my daughter, who was born with a pulmonary issue, was diagnosed and helped during her case. After seeing the dedication and hard work of the medical professionals who helped her, I knew I wanted to dedicate my business life to help those who have helped my family. So one day, a friend, Dr. Terreri, asked me to help grow his revenue for his pulmonary practice in Middle Georgia. I knew this was a great way to start my healthcare consulting business, but I struggled initially as I tried everything to help him be successful. Currently, he was at capacity with the number of patients he could see in a day, so just growing the number of patients in his practice just wouldn't work for him. Could I add more services to the practice? Again, he was so busy, he barely had any time for any additional services that require his time. I started to worry that I wouldn't help my friend and my new business would die before it even started. It was around this time that I heard of a new way to take care of patients called value-based care. For the first time, healthcare professionals were to be compensated for the results of delivering great patient care. I started to transition my friend toward this new model. Luckily, it worked. He grew his practice and he was able to take a vacation for the first time in over half a decade. Since then, I have helped my customers generate hundreds of thousands of dollars extra revenue for their clinics and medical practices. More importantly, I helped an industry that has continually helped me and my growing family. I have seen healthcare professionals and clinicians struggle financially to keep their doors open. And in this economy, unfortunately, it's only going to get worse. But I have seen the other side, and I believe you can too. So let's talk about the action you can take today to grow your medical practice. We're going to discuss how you can 3x the revenue of your clinic or medical practice without killing yourself in the process. Here's our 4-step Practice Value Creator framework. Here's a little secret. After following all these steps, a bonus level will be unlocked, and we'll discuss it later. Step 1, learn the new billing codes. When I started, I found these new value-based care programs, or VBCs, to be overly complicated. One day, I read an article about these new medical billing codes. These codes bridge the old fee-for-service care model, which you're doing now, you do the work, you get paid for it, and the new value-based care models. I researched and read everything I could about these codes and how to use them. I started to implement and follow the guidelines and saw that I was able to generate additional revenue for our practices. Once I implemented and followed the guidelines, I was able to generate additional revenue for my customers. For example, my doctor friend saw his practice begin to generate 6 figures in additional revenue a year. Step 2, train your staff to do the heavy lifting. Our healthcare professionals spend roughly 1 hour a month reviewing patient charts on VBC programs. Their staff really does the rest. Their staff verifies insurance, recruits, onboards, and supports patients. The reimbursement from the new codes helps pay for the staff's salary. Here's how you make it successful. First, you have to communicate the vision to your staff because ultimately they're going to help you scale your efforts. Next, you need to create a standard operating procedure and record them to scale the training. This is the only way you'll be able to ensure you get the best results. Step 3, select and recruit patients the right way. Go through your patient registry in your EMR and make sure patients will meet the requirements for full reimbursement. Have a clear process to recruit and onboard patients in office and via phone calls. Make sure there is ongoing communication with patients throughout the month. This really guarantees that they are engaged. Step 4, use software that increases patient compliance for these VBC programs. Invest in software that tracks billing requirements, monthly time, and compliance. Software that utilizes artificial intelligence or AI is really helpful for patient outreach because it will reduce the administrative burden of repetitive tasks. When you have higher operational efficiency within your medical practice, you will see guaranteed higher revenue. Are you ready for your bonus level? Here's a little secret. Your future growth for your medical practice can now be unlocked. Well, value-based programs are the biggest opportunity for medical practices and clinicians in this current high inflation environment. The data you collect will help your patients directly and allow you to generate revenue from these additional programs. For example, clinical trial opportunities has just exploded recently. And now, as a clinician or medical practice, you can take advantage of that. Following the practice value framework, you will be ready to continue to grow in these new areas of practice. Another thing to consider, the Center for Medicare Services, or CMS, is committed to moving every Medicare and Medicaid patient to a value-based care or VBC program by 2030. So practices and clinicians that don't adapt will be left behind. So you can't afford to wait. Will you be one of the few medical practices that will seize this opportunity? Well, here is the checklist for success. Number 1, learn the new billing codes. Number 2, train your staff to do the heavy lifting. Number 3, select and recruit patients the right way. Number 4, use software for increased patient compliance. And finally, unlock the bonus level where you will see future growth for your practice. If you need help in executing this checklist, don't hesitate to learn more by clicking the link below to understand more about our Practice Value Creator coaching program. We help healthcare professionals like you who are looking to expand even during this tough economy. Our summer cohort is starting soon. We have limited space, so reach out today so you don't miss out on this unique opportunity. Don't let inaction prevent you from providing the best patient care while growing your medical practice.